Welcome back to part 2 of our Internal Medicine Clerkship Faculty Development Series. This episode is aimed to teach you how to provide effective feedback to your students on the wards. In this video, we'll examine our role as teaching attendings. We will review a framework for impactful feedback. And lastly, we'll practice formulating feedback on specific skills. So let's get started. So why are we doing this? Students report either not enough feedback with their attendings and residents on the wards, or sometimes that the feedback is not concrete or constructive enough to help them grow in the clerkship. Additionally, they report that sometimes verbal feedback is markedly different than their written evaluations, which sort of frustrates them because they see that as a missed opportunity to grow while they're with their teachers on the wards. Lastly, structural changes like X plus Y fragment students' time with clinical teachers on the team, and it fundamentally changes the learning experience on the clerkship. So we have to re-examine our role as clinical educators on the wards and how we can meet the learning needs of our students. We need to learn how to give more regular, concrete, and actionable feedback to help students grow during even short periods of working together. To learn how to do this, let's first examine our role as teaching attendings for our students. What is your goal as an attending when you're working with a student? I know that we definitely all want to model great care and to teach a lot of really cool facts about internal medicine and maybe even to have them see us as an amazing teacher. But ultimately, our primary goal has got to be to help students learn and grow in the skills and knowledge of internal medicine. So effectively, what I'm describing is that we are a coach for students during their time on the clerkship. But if you're going to coach them over a short period, you have to narrow the scope of how many skills you can teach. Take a look at this diagram. While we teach more skills than are just shown here, these are the 7 skills that are assessed while on the clerkship. They include taking a history and physical exam, giving an oral presentation and doing a write-up, applying their knowledge to diagnostic reasoning, creating and prioritizing a differential diagnosis, communicating with patients, and lastly, incorporating feedback to get better. But you still can't teach all of this in 7 to 14 days. So when you sit down to set expectations with your students, try selecting just a few that you can focus on for the week. Narrowing your scope with the student creates this great space for feedback. And if the feedback is really actionable, you can see those skills grow really quickly, even just in a few short days. All right. Now let's talk about an approach to giving impactful feedback. What does actionable feedback look like? Here are 2 examples of feedback that really contrast in their actionability for the student. The feedback on the left is very abstract and is high inference. High inference feedback means that the person giving feedback is giving it based on their perception of quality. This can often feel a lot more judgmental. In addition, it's not clear what made the HPI better. In contrast, on the right, the feedback is concrete and low inference. It describes the behavior that the attending wants to see. A critical element to develop feedback that's concrete and low inference is to use a shared mental model, like the RHYME framework, as the gold standard for what you're developing feedback on. This means that you're not using an internal model that you've developed on your own based on students that you've had in the past or what you think is best based on your own behavior. Additionally, an internally developed model will be much more prone to biases, like recency bias, where you just remember your most recent students, or your own implicit biases. Now let's talk about some best practices for delivering that feedback on the wards. First, set expectations that you'll give frequent, bite-sized feedback. I usually do this when setting expectations on the first day. Secondly, talk with the student to select a subset of skills to work on for the time that you're together. Lastly, but maybe most importantly, set aside time to observe them taking a history and physical. All right, let's practice. You sit down with your student to do expectations on the first day. This is her 2nd clerkship out of 6. She had surgery last, and this is the middle of her 1st week out of 8 weeks of the clerkship. During the time where you discuss expectations around feedback, you ask the student, what would you like to focus on for the next 10 days while we're working together? She tells you that she still feels like she's got a lot of work to do on her histories and that she sometimes gets lost in the room and that she feels like her oral presentations are a mess. So based on her account, where would you guess that she is on the rhyme framework? Pause the video if you need more time to review. So we don't really know, right? We haven't seen her do anything. But from her descriptions, she is working on early reporting skills at this point. It's not uncommon for students near the beginning of the year to be at this point and to really need to dig into the reporter skills before they can really learn to think and put everything together. At this stage, what's really important is to watch her do a history as soon as you can. You schedule an observed history for tomorrow, which is a call day. During the observed history, you watch her begin to take the history from a man who's coming in with an acute presentation of his chronic heart failure. She has a warm demeanor and sits by the bedside. She takes a thorough history of his chief complaint, using open-ended questions. She seems to have trouble piecing it all together in time since his symptoms are so chronically severe. She then follows with a 12-point review of systems and all of the other historical data elements. Take a look at our direct observation feedback tool for history taking. It breaks down the history into multiple smaller behaviors, anchors it to the rhyme framework using color coding. The assessment selections are growth-oriented to really encourage you to mark what you see. What feedback would you give her? Push pause and formulate some initial feedback. Here's what I would focus on. In particular, I'd recommend that she gather a baseline and a basic past medical history actually before starting the HPI, and then lead directly into a chronological history to effectively create a timeline. I would also let her know that her rapport and communication style, as well as the thoroughness of the information she gathered and the open-ended questions, are awesome and on target. You also got to observe her do a physical exam on this patient. What type of feedback do you give on your students' or residents' physical exam? If your answer is not much or awkward silence, you're not alone. If you're concerned that you have not mastered your technique enough to give feedback to others, take a look at our exam scavenger hunt. You can see that there are actually many different aspects of the physical exam that you can give feedback on. You can give feedback on which maneuvers or systems they're selecting in order to pursue their top diagnosis or differential. And then once they select a maneuver, you can give feedback on how they perform the maneuver and their technique, if they can find the normal or abnormal on the exam, and how they apply their findings. So if their technique is correct, consider asking them, what did you find? And what do you think about what you heard or felt? That allows them to apply that knowledge and gives you a window into how much they know and how they're reasoning through it. Here are a couple resources that we recommend that have really helped us to become masters of our own physical exam and feel comfortable giving feedback to our students. Okay, back to our student case. During afternoon rounds, she presents the patient that she admitted. Her presentation lasts 12 minutes. Over 5 minutes is spent on the HPI. She gives the history of the disease with locates, a 12-point review of systems, and goes into a lot of detail in the other history sections. What feedback would you give her? Where do you start? Pause the video for a moment to reflect. So my takeaways for you would be, don't try to give feedback on many different things. She's got a lot of room to grow, but start at the beginning. The HPI is the foundation and one of the most important parts of our presentation. We have divided this feedback tool into each section to really encourage you to only give feedback on one section at a time. Surprisingly, it's the really concrete stuff about how to deliver that HPI that students often struggle with most in the early parts of the rotation and can have a huge impact on their oral presentations for the rest of the time. For this feedback, you choose to focus on filtering. You give examples about the amount of detail that might be more appropriate for this patient's history. You also give some general limitations to how much time to spend on the other historical sections like past medical history. You'll see this really concrete feedback lead to change as early as the next day. We totally recognize that you have a lot of work to do on the wards. The great thing about bite-sized feedback is that it can take less than 30 seconds every time you give it. The student will also ask you for more formal, either midpoint or end of sight feedback. They'll ask you for a signature. This is required by the clerkship. When it comes time to give formal feedback, if you've been giving them bite-sized feedback all along, you're not telling them much that they don't already know. It also sets a really safe climate for that more summative feedback that you're giving at the end of your time together. Thanks for watching this video. I really hope this was a helpful primer for giving impactful feedback. See you in the next video where we talk about assessment and narrative evaluations.